big controversy continues to go in the prostate world in terms of the value of PSA testing.
Right.
So what's the Dr. Geo opinion on PSA testing?
So the PSA testing, the reason why it's so controversial is because many people have been diagnosed for prostate cancer through the PSA screening process and been treated for it where they probably would not die from prostate cancer. In other words, they've been treated for very low-grade prostate cancer. That's a preponderance amount of the times that people have gotten treatment for prostate cancer, which is, it could be up to 70% of the times, quite honestly.
So most people, there are a significant amount of people who are getting over treatment and over angst and over expense.
Over angst, over expense,
right.
Side effects from the treatment,
right.
that has to be treated too.
Right.
So the cost continues to go up almost forever from the side effects of the treatment, if not prostate cancer recurrences.
And they would not have needed to be treated because prostate cancer is so slow growing.
In many cases it is, yes.
Right.
And so then you take this one PSA test, based on that test, you screen, you biopsy, you get surgery or radiation, and you have complications, and it starts a whole process there that's costly.
Should anyone ever be treated for prostate cancer based on one PSA screening, though? I thought it was about watching the acceleration or the movement of the PSA over time.
Right, so PSA in it by itself can, the PSA velocity, as you, or PSA kinetics, as they would say, how the PSA moves within time, can provide some valuable information with regards to, is this prostate cancer related, or is it benign, or just inflammation of the prostate? So yeah, it has to be at least 3 PSAs for you to get some value from that. Of course, there's also the physical exam, which gives you some information, and there's other things like MRIs and things.
I know my husband said that his doctor, it doesn't even necessarily do the physical exam anymore, that they haven't found that to be as effective.
It's, again, it's one of those situations where, you know, there are a lot of men who are diagnosed with prostate cancer who have a normal physical exam, right? I care to find even the minority of men that have abnormal physical exam, even though they don't have symptoms. That could be, you know, life-saving. So maybe the reason is because many men have no symptoms, physical exam is fine, they're still diagnosed with prostate cancer. But you can often find a very hard nodular type of scenario in the prostate that can be indicative of prostate cancer. Sometimes you could find that scenario with a low PSA. It's not abnormal to be diagnosed with prostate cancer, even an intermediate prostate cancer with a very low PSA.
Okay, so if PSA doesn't work, digital rectal doesn't necessarily work, what am I to do? Like, how are you to be able to screen?
It's a combination
how
of
do you
things.
diagnose?
So a combination of things work, not just one thing. And this is, of course, before, I mean, can every man get a MRI of their prostate? The MRI, the technology called a multiparametric MRI of the prostate, is really sophisticated technology where you can see clear if there's abnormal tissue in the prostate. Very expensive. You cannot just get everybody to, you know, digital rectal exam costs nothing. PSA test is maybe $100 per test. The MRIs are very expensive. So you have to do several things before you even get them to get the MRI.
Risk,
so the velocity of the PSA and the physical exam is actually, you know, a valuable thing to do.
Okay, so love it or hate it, in your recommendation, PSA they should still continue to get, but watch the changes in it.
Correct. It's not only about the number. We do know that there's problems with the PSA, but it's what we have right now. Nothing is yet better. Let me also say this. There's all the other tests that, something called a 4K score that I want to mention. So what is that? That's a blood test. It's more sensitive to the PSA. It's better. But again, even what gets you to the 4K, the PSA. The PSA test. So there's other things. There's genetic testing that one is doing nowadays. There's other things that gets you to either do a MRI or eventually a biopsy.
If you have family history, does that put you at higher risk? So you should jump straight to the MRI. You know, the same way the screening for women for breast cancer has evolved over the years, depending on risk factors, et cetera.
If you have a family history, you should start, number one, at 40 years old. Number two, you don't jump right into the MRI like women would do a mammogram.
A digital,
you do a PSA, you watch the velocity, you do a digital rectal exam. That can guide you very nicely into what else needs to be done, if anything else.
All right. PSA, love it, hate it. It's what we got.
It's what we got.
All right. Thank you, Dr. Geo.
You're welcome.
If you liked what you just saw, we have a whole lot more with Dr. Geo Espinosa at our website, bottomlineinc.com. And do me a favor, share this, tell your friends. We have so much great information. Come to bottomlineinc.com.